Carrollwood dates back to the 1880s when Reverend Isaac Ward Bears, while in search of a more temperate climate, commissioned a wagon train with 11 of his church members, close friends, and family to make the 11-week trek from Missouri to Lake Magdalene. After arriving in what is now known as Carrollwood, they had hoped to survive off the abundantly lush orange and citrus trees. Unfortunately, they arrived on the eve of 2 hard freezes that would decimate the majority of the citrus crops in Florida. They persevered and established what is now known as Lake Magdalene United Methodist Church. The church relocated several times from the original location then to what is now known as Citrus Park, and then back to the original location after the land was donated by B.E. Stahl, which was Reverend Bear's son-in-law. By 1900, the population grew to 459, and Horse Pond School, which is now known as Lake Magdalene School, was built in response to this overwhelming growth. Despite what was considered a large population of 1,269 people in the 1930s, the area remained mostly rural until the 1960s, when Matt Jedden, who is fondly known as Father of Carrollwood, started developing the land, causing suburban growth. Jedden continued building and developing Carrollwood through the 1980s. By the 1990s, Carrollwood had passed its peak, and developers started looking for new and more exciting areas to build. Today, very few orange groves remain. They've been replaced with homes, shopping centers, strip malls, and eateries. But if you're willing to look closely, a person can still find some traces of the past nestled within the community. There is definitely no food desert in Carrollwood as compared to the less densely populated but up-and-coming Lutz. In Carrollwood, you can actually have it your way. There is a plethora of eateries ranging from fast food to 5-star restaurants. Housing ranges from a few scattered apartments and townhomes to luxuriously walled and gated communities. There's primarily one hospital in Carrollwood, but the newly built St. Joseph's North Hospital is only a car ride away. Because of the increasing age of the population, many nursing homes, doctor's offices, and walk-in clinics are available. In my opinion, from what I've observed and through our detailed analysis, Carrollwood is lacking in little structurally compared to the surrounding areas of Tampa. Carrollwood is a beautiful and well-established area that does not have any subsidized housing, homeless shelters, or free clinics. If you build it, though, they will come.
During the Carrollwood community assessment, the primary population issue noted was that there was a large increase in the number of older adults residing in the community. The census showed that during the year 2000 to 2010, there was a 73.6% increase in the population of ages 85 and older. Stroke is a major health concern in the Carrollwood community. Literature states that stroke is one of the main causes of death within communities of older adults. The possible health needs for the Carrollwood population are implementation of programs that teach how to reduce the risk for stroke, like education and management of hypertension, smoking cessation programs that promote a healthy lifestyle, as well as the availability of rehabilitation centers and hospitals certified as a primary stroke center. There are many health-related resources available to the Carrollwood community. These resources vary from hospitals, urgent care clinics or walk-in clinics, private doctor offices, nursing homes, assisted living facilities, and home health agencies. These facilities are very accessible, acceptable, and affordable. The majority accept commercial insurances as well as Medicare and private payments. Statistics show that every year 1 out of 3 older adults fall, making this the leading cause of death in older adults due to unintentional injury. These falls often lead to lower quality of life due to injuries and fear of falling again. The third leading cause of death in the United States is stroke. Suffering a stroke can not only lead to physical and mental disabilities, but it also costs billions of dollars to the healthcare system. People with dementia are 3 times more likely to be hospitalized for preventable situations. Safety is a big concern since these patients are at risk for falls as well as nutritional deficits.
Very well manicured lawns and deed restricted communities with strict homeowners association is what you can expect to see in the beautiful unincorporated community of Carrollwood. Carrollwood's water supply is mainly supported by the Hillsborough River. The water quality exceeds the state and federal criteria. Some houses have septic tanks while others use the city's sewer system for wastewater disposal. As noted through the windshield survey, standing water on the sidewalks is indicative of the need for an improved drainage system in certain subdivisions. Carrollwood has many lakes with the retention of water, which also increases the chance for mosquitoes. However, no large source of air pollutants was noted. Carrollwood community is highly involved in the Hillsborough County recycling program, and trash picked up is done on certain days throughout certain communities by the city of Tampa. With a population of over 7,000 and the average income ranging from 80 to 100,000, the overall economic standing of Carrollwood is quite notable, with a plethora of successful businesses. The community of Carrollwood follow the political jurisdiction of Tampa, governed by Mayor Buckhorn and Tampa City officials. However, the North Tampa Chamber of Commerce helps Carrollwood improve the economic growth by promoting businesses and promoting tourism to the North Tampa area, along with advocating for budget increases to renovate or remove old dilapidated buildings in an attempt to maintain property values. All government officials can be easily reached via email or by telephone. Public hearings are often set to rule on demolition of old buildings in an attempt to maintain the integrity of Carrollwood and help keep property values up.
Between 2000 and 2010, there was a 73% increase in the population of those aged 85 and older. Despite this overwhelming growth, only one hospital still remains in Carrollwood. Transportation is limited. As population increases, the elderly must look to other forms of transportation as driving becomes more difficult. Currently, only 3 bus routes originate in Carrollwood. The majority of business and career opportunities within Carrollwood are primarily retail and restaurant-oriented. The professional business person must travel outside the community and into surrounding areas of Tampa for corporate employment. The main thoroughfares of Carrollwood are highly congested during rush hour traffic. Drive times are easily tripled during this time. Despite the 34 churches and religious organizations, only 2 of those are non-traditional to meet the needs of the non-American cultures. Even with the plethora of strip malls and convenience shopping establishments, there's no mall in Carrollwood. Malls provide one-stop shopping without the need to travel to multiple locations. Many people use mall walking as a form of exercise. The malls offer the elderly the opportunity to benefit from their climate-controlled environments, to provide shelter from the elements. They are warm in the winter and cool in the summer. The prioritization of these problems were based upon the most inherent needs of the community, with healthcare being at the forefront.
In other countries, when there is a lack of hospitals in an area, healthcare clinics ran by physicians, nurses, and other healthcare providers are set up to help the public. The Carrollwood community deals with the need for more hospitals by going to one of the other hospitals that are close to the Carrollwood area, such as Florida Hospital Tampa, Veteran Hospital, Moffitt Cancer Center, and St. Joseph's Hospital North. This is especially done when pediatric care is needed, since the only hospital in Carrollwood doesn't offer pediatric services. There is also many urgent care clinics that can be used in case of emergencies. A community health nurse can address the issue by arranging the health fairs at different locations throughout the community. The nurse can perform primary and secondary prevention, so there is a lower need for hospital visits within the community.